So most of us are familiar with type 2 diabetes, formerly known as non-insulin dependent diabetes mellitus. So also known as adult onset diabetes. So that is different from type 1 diabetes in that the body still makes insulin, but people have the lack of ability to use it. So they are unable to use their insulin. They're unable to get the glucose receptors to the cell membrane. Their body cannot uptake glucose. And so this has to do with result of deconditioning. 80 to 90% of people with type 2 diabetes are obese, but that means 10 to 20% are not. So there is a genetic component. We'll talk a little bit about that. Increased abdominal fat is a risk factor for diabetes. Increased waist levels, 100 centimeters or 40 inches in men, 88 centimeters or 35 inches in women. And people with very high waist circumferences also tend to have very high triglyceride levels. So that also tends to increase their risk for type 2 diabetes. So this is by far the most common. Most people are going to develop this in adulthood, but with increases in childhood obesity, there are younger and younger ages of people who have type 2 diabetes. So there can be teenagers that have type 2 diabetes. Gestational diabetes is a type of diabetes that occurs during pregnancy. So the women are going to be tested. They'll have that oral glucose tolerance test, that 2-hour blood test, typically in their second trimester, about halfway through, a little more than halfway through, 24 to 28 weeks of pregnancy. The hormones of the placenta lead to insulin resistance on their own. And there are several reasons why women want to be tested and need to be tested for gestational diabetes. They tend to have very large babies. The excess, the lack of production of insulin tends to have lead to large babies. So when you hear on the news about these very, very large babies being born, it's almost always the woman had gestational diabetes. So women who, and so that means they may need a C-section. So that leads to more complications. Gestational diabetes is also likely to return in future pregnancies. So if women have it one time, it's likely to come back. And it also leads to increased risk of type 2 diabetes post-pregnancy over the 5 to 10 years following birth. And with these large babies being born, greater than 9 pounds, that can put these children on a trajectory towards childhood obesity. So very large babies tend to be very large on the growth chart, on those height weight growth charts. They have different growth charts for infants, but they tend to track, and that tends to track as they go from infancy into childhood. Other diabetes causing illnesses, acromegaly. So if people have growth hormone tumors, excess growth hormone, either through drugs, performing enhancing drugs, or maybe they have a tumor in their pituitary or hypothalamus, and it causes them to increase their growth hormone secretion. So, athletes who use growth hormone can be at risk for diabetes down the road. Adults who have Down syndrome, they also tend to have diabetes. If you've been exposed to rubella or German measles, and we've talked about side effects of drugs such as glucocorticoids, prednisone, that can increase someone's risk of diabetes, and other types of diseases such as diseases of the pancreas. We had covered cystic fibrosis or pancreatic cancer. So pancreatic diseases can also lead to diabetes. And if you look at the risk factors for type 2, so like many of the conditions we talk about this fall, and age is an issue typically seen in older persons, but it can be seen in younger persons as well. Overweight or obese, 80 to 90% are obese, physically inactive, And this is where family history is important. Parent, sibling with diabetes. So there is a much stronger family history for the type 2 than the type 1. It's somewhat counterintuitive. People who are of non-Caucasian races and ethnic groups, as we mentioned about having a large baby, having high blood pressure, having low total cholesterol, or as we talked about in the previous slide, high triglyceride levels, polycystic ovarian syndrome, so women who have that, PCOS, that increases your risk for type 2 diabetes, having previous impaired fasting glucose or pre-diabetes. As we mentioned, it tends to progress to diabetes. Acanthosis nigricans, that is, and we'll pull up some photos in class, it's a rash around the neck or armpits, and it tends to occur in people who have insulin resistance. It can be seen in children. It looks like dirt. It looks like you have dirt around your neck or armpits, but it's actually an indicator, a coloring of the skin that comes from insulin resistance. And as we talked about too, cardiovascular disease. So that diabetes really accelerates that atherosclerotic process. So it's very dangerous for people who have diabetes and heart disease because their risk really goes up.